Look, another case with me with the dry derm. I am Dr. Natthawan from the northeastern of Thailand, and this is my first time of the UltraV speaker. It's my pleasure. And as Dr. Fruit, introduced the machine, I will speak with more detail about the machine a little bit. And then after that, I will show my case. Like the first said before, the Triderm is a radio frequency machine. So we have the triple system. One is the RF cannula. The machine which come from the cannula, and the useful is for skin tightening, the collagen stimulation, and lipolysis. And we have a handpiece and 3 sizes of the cannula, 18 for the body and 19 and 20 gauge for the face. The second part is the RF plasma. This is the transdermal energy to make the patient better file linker and do the non-surgical double eyelids. And we have the handpiece with the plasma tip. And the last one is the RF cannula. That we have the 31 gauge and have another handpiece. And the tip, the needle is a single use also. I will skip this slide. This is the machine introduced. And this is my case. I have 3 cases today. 2 cases is a normal case, and another one is the extraordinary one. First is a female, 33 years old. She has no underlying disease, and the diagnosis is a satisfied with a submental fat classification 3. This is the video when I treat the patient at my practice. First, you have to identify submental fat. This video takes time around 50 minutes. And then you mark the localized for the infiltration and the point for insertion of the cannula, and then you put the electronic patch on the patient body. This is a monitor, and we clean out the sterility as the first said before. And then after that, we inject the localized anesthesia. And in my technique, I infiltrate the tumescent. Not much. This is the localized with 2% lidocaine with adrenaline. It's easy to use because the monitor has energy level and the minutes in front of the screen. And then I penetrate the guide, the needle guide, and then infiltrate the tumescent. Per one side per area, I use around 5 cc per area. So for the top submental part, totally I use not more than 10 cc of the tumescent. I think in my practice, the infiltrate of the tumescent have another benefit for the control the temperature. When you do the tumescent, the skin temperature is lower than the normal skin. When you do the RF, that have a heat accumulate, so we can reduce the risk of burn at the skin of the patient's skin. We do the both side infiltration, and you left the solution make the skin the vasoconstrict around 5 to 10 minutes. And this technique can reduce the trauma because the vasoconstrict. We insert the tip to the handpiece. In fact, the handpiece is not sterile, but we can do the semi-sterile technique also. And then insert the cannula. พี่ด้วยมีเสียงไหมคะ After insert the cannula, the energy will produce at only the tip, and you have to move the hand along the part of the fat. And be careful to you have to move all the time, not stop at any part because it can make the patient to skin burn. And at the first time is very difficult because you have the skin tightening, but after that, your fat will more easy and we can go very fast. Per area, the company recommend not more than 3 to 5 minutes. But the end point that you can observe that when you touch the skin patient is more warmer. You have to move around inside the submental area. And if you see that no bleeding because of the vasoconstrict, and the patient feel very comfortable, not so much hurt. For this case, I do the RF cannula around 10 minutes. That's enough. After one side, I will show you the immediate result that you will see how different after you do finish one side, how much better, how much skin tightening, and how much more the better for the lipolysis. As I mentioned before, this case is a submental fat class 4, but can you see? This one immediately result more tightening, and the fat is much better from the video. It's obviously seen. So I have to skip the video. This is the result immediately after treatment. For the frontal view is much swelling, little bit swelling, and after result after 3 months. This case I did for 2 sessions. I did do 2 sessions and take a photo after 3 months. For the frontal view, it's much better for the face contour. At the oblique view, you will see how much different after 3 months, more skin tightening, and the fat is much better. You will see more firming of the jawline. At the profile view, you will see how much different of the fat and more contour of the face and no scarring after 3 months. And the patients come back with higher satisfaction. If you have the patient that have a more classification of the submental fat, you can do the liposuction before, like a manual liposuction, and then do the RF cannula on top. This is my second case, the male 55 years old. I will skip the video. It's the same procedure. And you will see the result immediately and after 2 sessions, and then the follow-up for 3 months. And if you will recommend the patient to do the diet control and do more exercise, it's obviously seen more. And you see the more firming of the jawline, and the fat is much better. We can change the classification from T to maybe 1 or 2. And if the patient, I think in my practice for 2 years of this machine, the most effective patient is a patient that have their classification 2 or 3. If much more than that, you have to do the liposuction before. Okay, this is the last case. This is a female 47 years old come with maybe HA lump because the history is not obviously sure. She said that she had to inject the chin before, and after that she can palpate the lump at her submental area. I do the same treatment. ช่วยสกิปไปข้างหน้านิดนึงได้ไหมคะพอดีอันนี้มันไม่ได้ยังอยู่ในวิดีโออยู่ค่ะแต่ว่าเรื่อง because I don't have the computer, so the computer control that. This case had the 2 sessions of the treatment from the RF cannula. This is the first session. When you see the lump is here, the lump is at the middle part, and I do the RF cannula inside of the submental area, but I will do more energy and more time at the middle part. And after session 2, you will see the difference how much skin tightening. เลื่อนไปอีกนิดเขาจะคิดไปอีกนิดค่ะได้ค่ะ You will see the tightening this area is much more better than the first time, the first session, but only have the lump, but the lump is smaller, but still have. You see the feeling of my patient that she feel that she cannot palpate anymore after do the treatment. So she tried to palpate, but it's done. Sorry, for my practice, this is a success one because the patient have a satisfaction is very nice. And for the result, after she follow up after 2 months, you will see when she chin down, you will see more tightening of the frontal view and no obviously the lump at the oblique view. You will see much better. Profile view, you will see the tightening skin, and if you see when she's chin down, the smaller lump and more skin tightening, and the jawline is much better. So this is my case for the triderm juice. I used this machine for 2 years, and I think it's a very interesting machine when you compare to another modality like thermage or another device because it's easy to use, and for me, but the cost is much cheaper. Thank you.